I'm just going to be talking a little bit about what to do in an emergency situation where we might need to use CPR, we might need to use an AED, or if, I'm going to tell you what to do if somebody is choking. All right, so we're going to start off today. I just want to say this is not a certification class, so if you do want a little bit more information and you want to get certified, just let me know. I can set up a class, or I can point you in the right direction to find a class. All right, so we're just going to start by watching a quick video. The first video is about our 3 action steps, what we want to do when we have established that there is an emergency.
Now that you have recognized an emergency and decided to take action, follow the emergency action steps. Check, call, care. Before rushing to help an injured or ill person, you need to check the scene, so stop and look around. By answering the following questions, you will gain the information you need to proceed. Is the scene safe to enter? Hazards such as fire, spilled chemicals, and traffic, to name a few, could endanger you or any bystanders. If the scene looks unsafe, stay clear and call 911 or the designated emergency number. What happened? Check for clues that might tell you the cause of the emergency. How many people are involved? In an emergency with more than one injured or ill person, you may need to prioritize care. What is going on with the person? Form an initial impression about the nature of the person's illness or injury. If you see severe, life-threatening bleeding, take action to control the bleeding using any available resources. Is anyone else available to help? Bystanders may be able to provide valuable information about the situation or the person, along with getting needed items, controlling crowds, and reassuring the injured or ill person. Once you've checked the scene, you need to check the person. If you are not sure whether a person is unresponsive, shout using the person's name if you know it. If there is no response, tap the shoulder for an adult or child, or the bottom of the foot for an infant, and shout again while checking for normal breathing. Check for responsiveness and breathing for no more than 5 to 10 seconds. If there is no response and the person is not breathing or is only gasping, the person needs help right away. This brings us to the second emergency action step, call. Unresponsiveness, trouble breathing, and severe bleeding are all signs of a life-threatening emergency. If your initial check reveals these or any other life-threatening conditions, make sure that someone calls 911 or the designated emergency number right away. The final emergency action step is to give care according to the conditions that you find and your level of knowledge and training. Always remember, check, call, care, and you'll be ready to respond to any emergency.
All right, so just as a review, what was our first action step?
Check.
Check. That's right. So we always want to make sure that we are checking the scene. We want to get as much information as possible. For one reason is we want to make sure that we know what's going on before we call emergency personnel so that they have the tools to be able to help them as quickly as possible. All right. So we also want to check the scene to make sure that it is safe for us to enter. If it is safe for us to enter, we can go ahead and go help them. But if not, we are going to wait for emergency personnel to get there before we go and put ourselves in harm's way. So that's another important thing to remember. So also when we are checking the scene, like I said, we want to make sure that it's safe. But we also want to try and make an initial impression of what we think happened here in this situation. So is the person ill? Did they have come down with some type of illness suddenly? Or are they injured anyway? So we want to look up and down the person and try and figure out exactly what we think happened from there. Once we just say, okay, this person is safe, we want to approach them. So if this person is on the floor and their eyes are open or they're making some type of movement, they're responsive. So we'll follow a couple of different steps, but today we're going to talk a little bit about when a person is unresponsive. But when we are checking someone, one way that we can check for responsiveness is to shout their name. So let's say Scott here is passed out here on the floor in the fitness center, and I go up to Scott and say, "Hey Scott, are you okay?" If I don't get a response there, I can tap down on his shoulder, "Hey Scott, are you okay?" All right, if they do not respond to any of these stimuli, that means they are probably unresponsive, okay? If we then decide, whichever we decide, if there is some type of emergency, we need to, our second action step, what's our second action step?
Call.
Oh, right. So we want to try and call for help. So in our initial impression of the situation, we also want to check to see if there's anyone else involved. All right, is there anyone else who's injured? Is there anyone else that is able to help us? So if there's anyone else that's able to help us, I might say, Matt's here, so I'm saying, Matt, you go call our emergency number, or 911, and also go get the AED. Is anyone aware of what our emergency number is? What do we do?
4444.
That's right. So we call security. So we call 4444, that's our extension. So they're gonna call emergency personnel from there. So you wanna give them as much information as possible, okay? Our third action step is what? Care. That's right. So like I said today, we are going to be talking a little bit more about what to do in emergency situations where someone is unresponsive. If the person is on the floor and they're unresponsive, we are most likely going to probably do CPR or use the AED. So like I said, we want to get that AED as soon as possible, and we'll start giving care right away. But before we do that, I'm going to talk a little bit about some PPE, they call it, so personal protective equipment. All right? So after this seminar today, I want everyone to try and locate a first aid kit. All right, if you have a first aid kit in your office, go ahead and check it out, make sure that everything is up to date. Some things expire, like some of the antiseptic wipes and things, so kind of check it out, make sure you have enough Band-Aids and bandages and things like that, just in case there is an emergency. Now, two things that are really important when you're giving CPR are our PPE, which are our gloves. So most first aid kits have a little package of gloves in them, so you want to find those. And I don't know if a lot of them have it, but I have a lot of these CPR face shields. So if anyone would like to put one or two of them in their first aid kit to have on hand, they're really easy to grab and keep for when you're doing CPR. So check out your first aid kit, see what you might need, try and update it if you can, and I have these if you want some. You can come and see me down the fitness center if you want one, or right now too. All right, so we are going to talk next about CPR.
Hey, are you okay?
After confirming that someone is unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR.
He's unresponsive. Go.
Ensure the person is on his back on a firm, flat surface such as the ground. Next, kneel beside him and place the heel of one hand in the center of his chest, with your other hand on top. Interlace your fingers and make sure they are up off the chest. Position your body so that your shoulders are directly over your hands. With this technique, you can use your body weight to help compress the chest. Now, give 30 chest compressions. Keeping your arms straight, push down at least 2 inches, then let the chest return to its normal position. Continue to push hard and fast, giving compressions at a rate of between 100 and 120 compressions per minute. For a child, push down about 2 inches, and for a smaller child, you may only need to perform chest compressions with one hand. Next, give 2 rescue breaths. First, place a breathing barrier over the person's nose and mouth. Then, open the airway by putting one hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a pass-neutral position. For a child, you'll only need to tilt the head to a slightly pass-neutral position. Pinch the nose shut, take a normal breath, and make a complete seal over the person's mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath.
1 and 2 and 3 and 4.
Continue giving sets of 30 chest compressions and 2 rescue breaths until
14, 15,
you notice an obvious sign of life.
16, 20, 21, 22, 23,
An AED is ready to use and no other trained responders are available. You have performed 5 sets of CPR and another trained responder is available to switch.
1 and 2 and 3 and 4 and 5 and 6.
You have performed 5 sets of CPR on a child. You are alone and need to call 911.
17, 18, 19, 20, 21, 22, 23, 24,
EMS personnel take over.
29, 30.
You are alone and too tired to continue. Or the scene becomes unsafe.
1 and 2
Are
and
they
3 and
AED for
4.
safety?
All right, does anyone have any questions so far about anything? Forgot to ask that about after the first one. No? Okay. So, CPR. How many compressions? 30. How many rescue breaths? 2. Awesome. All right, so when we find our unresponsive person, we've checked the scene, the scene is safe, and we've determined that they're unresponsive. So, again, we want to make sure that they are unresponsive. We're yelling their name, we're tapping their shoulder. From here, if we're going to try and see if we have any breathing. So we are going to listen for 5 to 10 seconds, get real close. You can put one hand on their chest to see if you feel any rise with their breath, and we're listening for those breathing. So no more than 5 to 10 seconds. Okay, so once we've determined that they're not breathing, we can start CPR. So we always, again, want to make sure that we have our personal protective equipment. So I have, again, here my breathing barrier, which I'm just going to lay right on top here. So these have little faces on them, and it says this side up. So that side, right over the mouth. Now, if this is a real person, we probably don't want to put this on right away. We'll probably wait till we're giving the rescue breaths, just so that we can tell if someone is actually breathing. All right, so I found that Scott here is unresponsive. I've told Matt, go get the AED and call 911 or call security. So from here, we want to make sure that we are in a good position. So this might be a little too far away. We want to bring our knees right close up to the person, the heel of our hand right in the center of their chest, taking our other hand, interlacing our fingers, and we want our shoulders to be directly over our hands so that we have a nice and long lever length here. So we're pressing 30 compressions. Now when we're doing these 30 compressions, I'm going to do them since I don't have mannequins for everyone. I want everyone to count with me. So we're going to count 1 and 2 and 3 and 4. Once we get to 10, we'll just count 10, 11, 12, 13, and so forth until we get to 30. Okay? Are we ready? Ready? I'll say go and then we'll start counting. Ready, set, go.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
All right, so after our 30 chest compressions, we are doing our 2 rescue breaths. So we want to make sure that we're tilting the head back, so using 2 fingers, lifting the chin, placing our other hand on their forehead. All right, to get a nice, straight, clear airway. From there, we are going to pinch the nose and create a seal over their mouth. We really want to make sure that we create that seal, and we're doing 2 nice, deep breaths. So as we're doing the breaths, we want to make sure that the chest rises. Now it's kind of hard to see on these mannequins because they're kind of old, but the chest will clearly rise and fall. Now if you don't see that it clearly rises, continue with the chest compressions, and then the next time around really try and make sure you get a good airway from there. Okay? Does anyone have any questions from there? Good to go.
I assume if for some reason the person shows some movement or activity during those 30 compressions, you immediately stop.
Correct. Yeah. Once you see any signs of life, we're stopping and trying to reassess the situation. All right, so again, we're going until either we see signs of life or we have someone that can take over for us. Because sometimes it might take a while for someone to get there. We might get tired, so hopefully someone is also there who can switch over with you from there. But it's pretty simple. Again, do you remember how far we want to go with our chest compressions? How many inches? 2 inches. Yeah. So also one thing about CPR, you probably will break the sternum, so just be aware of that. That's okay. It's something that's going to happen with it. Just something to be aware of, and don't be too worried about it. If you do, just keep going. Okay? Awesome. Next, we're going to be talking about how to use an AED.
One question on
Yeah,
that. So
of
is there, let's say you're out in the wilderness or something like that and there's no one else coming.
Right.
Is there a point where you just, time-wise is passed and there's no chance for recovery?
You know, that's a good question. We haven't really talked about that. It doesn't really cover that in this course. They usually kind of assume that help is going to come. So that's definitely something to look into.
Okay.
But
Well, I mean, is it like if it's 5 minutes and you're not, there's
right,
probably
because I
no
know there's a certain
probability.
amount of time where I think you lose like brain function at a certain point. So that
And
is
if you
something.
get tired too, like if you can't do it anymore, then just stop.
Yeah.
Because there's no point
Yeah.
in being keeled over.
I understand,
as
you
well
both
as-
died in the woods.
Yeah, right. It's a good question, though. Something to think about. Anyone else? Questions? Yeah.
It's been many years since I've been certified, but do you no longer check the airway before? Okay.
No.
How do you
Um,
modify for an infant?
For an infant? I think I have the video next after this, actually. I didn't bring my infant dummy with me today, but.
If an infant is unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR. Ensure the infant is on her back on a firm, flat surface such as the ground. Next, stand or kneel to the side of the infant and place 2 fingers on the breastbone just below the nipple line with your hand closest to the infant's feet. Now, give 30 chest compressions. Using the tips of your fingers, push down about 1.5 inches and then let the chest return to its normal position. Continue to push hard and fast, giving compressions at a rate of between 100 and 120 compressions per minute. After the 30th compression, prepare to give 2 rescue breaths. First, place a breathing barrier over the infant's nose and mouth. Then, open the airway by putting 1 hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a neutral position. Make a complete seal over the infant's nose and mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath. Continue giving sets of 30 chest compressions and 2 rescue breaths until you notice an obvious sign of life. An AED is ready to use and no other trained responders are available. You have performed 5 sets of CPR and another trained responder is available to switch. You have performed 5 sets of CPR, you are alone, and need to call 911. EMS personnel take over. You are alone and too tired to continue, or the scene becomes unsafe.
All right, so just a little review. With infants, it's 2 fingers, have them on a flat surface. Other than that, it's the same 30 chest compressions and 2 breaths.
What's the purpose of the breathing barrier?
So it's just kind of protection for yourself, just in case, I don't know if they do have some type of illness or something that you're protected. Also, sometimes when people are unconscious, they may tend to vomit or have other bodily fluids. So it's kind of, it's not the best protection, but it does give you some from there. They have some more in-depth kind of mask that you could purchase. I have one in my office, but it's like it covers your mouth, like it's like inflated, and it's like more like they use in like hospitals and stuff like that. So you can purchase some ones that are a little bit more protective, but this is just going to give you like the base level of protection.
Thank you.
Yeah. Anybody else? Awesome. All right. Next, we will talk about using an AED. It's hard with gloves on.
When a person is in cardiac arrest, use of an AED can help restore a normal heartbeat. If you are the only trained responder on the scene, turn on the AED as soon as it is available and follow the voice prompts. Once the AED is turned on, remove all clothing covering the chest and wipe the chest dry if necessary. Using the appropriate sized pads, place one pad on the upper right side of the chest and the other on the lower left side of the chest below the armpit. Remember, you should not use the pediatric AED pads or key on anyone older than 8 years or weighing more than 55 pounds. However, adult AED pads can be used on a child if pediatric AED pads are not available. If the pads touch, which is usually the case with small children and infants, place one pad in the middle of the chest and the other pad on the back, between the shoulder blades. Plug the pad connector cable into the AED if necessary and prepare to let the AED analyze the heart's rhythm. Make sure no one, including you, is touching the person. Say, clear.
Clear.
In a loud, commanding voice. Be ready to deliver a shock if the AED determines one is needed. To do this, make sure no one, including you, is touching the person. Again, say, clear. In a loud, commanding voice. Push the shock button to deliver the shock.
Shock delivered.
After the AED delivers the shock, or if no shock is advised, immediately begin CPR starting with compressions. Continue giving CPR and following the AED's prompts until you see an obvious sign of life or EMS personnel arrive. If there are 2 or more responders, the steps will be slightly different. Responder 1 will continue CPR, while Responder 2 sets up the AED. When the AED prompts, analyzing heart rhythm, Responder 2 says, clear.
Clear?
Then the responders switch roles. Responder 1 will now operate the AED, and Responder 2 will now provide CPR. The responder should switch roles in this manner each time the AED analyzes the heart rhythm. Notice how CPR and AED use are working together as parts of the cardiac chain of survival. When CPR is not interrupted to prepare the AED, chances of survival are
increased. That's it. All right. Any questions from the video? All right. So just to go over an overview of what the video went through. So if the AED has finally arrived, so I'm just going to grab one of these out here and show you. We do have AEDs located throughout the building, so make sure if you don't know where the closest one is to you. I'm not 100% sure where they are. Van, do you know where they are?
Lobby C.
Obviously.
Yeah, we got one in the control center, one in the fitness center, Was it Labienne? Labienne? Okay.
Yep, so make sure you know where the closest one is to you so you can point someone in the right direction if you ask them to go grab one for you. All right, so these are all pretty basic, very similar from AED to AED. Very easy to use, we'll just follow the voice prompts. So we'll start by placing the pads. Now they have pictures on them, so it's very hard to mess this up. So we'll start with one on the right top. And if you do put them in the wrong places, it will still work. This is just for the preferred placement. So the other one will go right on the lower side of the left chest. So once we have placed the pads, we can go ahead and plug in the connector and turn it on. So again, you'll follow the voice prompts as it tells you. Now, some of them, you'll hear that beeping sound. This one does not do it, but I'm gonna tell you before it starts. You'll hear a beeping sound, and that's a good cadence to go and do your CPR with. So once you start your CPR, you hear the beep, 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 and that's a good cadence for that, which is really cool. Like I said, this one doesn't have it.
Analyzing heart rhythm. Do not touch the patient.
Analyzing.
Shock advised.
Clear.
Charging. Stay clear of patient. Deliver shock now. Press the orange button now.
You'll have to press the button so you make sure everyone is clear.
Shock delivered. Analyzing heart rhythm. Do not touch the patient. Analyzing heart rhythm. No shock advised. It is safe to touch the patient.
So once they say no shock is
Check
advised,
airway.
and we
Check
can
breathing.
notice that there is
Check
still no
pulse.
breathing, we'll again start
If
CPR,
needed,
and
begin
it will show it.
CPR.
So I'll go ahead and do a round. Everyone count with me.
All right.
1, 2, 3, go.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29,
30. 2 rescue breaths.
Analyzing heart rhythm. Do not touch the patient.
And then it'll go through the steps one more time. Right? Any questions? Good to go? Okay. All right. Next, we are going to talk about what to do if somebody is choking. And one question before we continue, when should we stop? What are all the reasons we should stop the AED or stop CPR? Yes, emergency personnel arrived, or signs of life.
You're in the woods and
And it's just over.
After confirming that the person is choking and obtaining consent, give a combination of 5 back blows and 5 abdominal thrusts. First, position yourself to the side and slightly behind the person. Bend the person at the waist so that his upper body is as parallel to the ground as possible. Firmly strike the person between the shoulder blades with the heel of your hand. Give 5 back blows. After the 5th back blow, reposition yourself to stand with one foot in front of the other, placing your front foot in between the person's feet to provide balance and stability. Find his navel with 2 fingers from one hand. With your other hand, make a fist and place the thumb side against the person's stomach. right above your fingers. Cover the fist with your other hand. Give 5 abdominal thrusts, pulling inward and upward. Continue giving sets of 5 back blows and 5 abdominal thrusts until the object is forced out and the person can cough forcefully, speak, or breathe. Or, if the person becomes unresponsive, send someone to call 911 if it has not already been done. Carefully lower the person to a firm, flat surface and immediately begin CPR, starting with compressions if you are trained. For a child, you might need to kneel in order to give effective back blows and abdominal thrusts.
All right. Does anyone have any questions from the video? All right. So again, if we find someone who is choking, a lot of times if people are choking, if they can talk or they're coughing, that means they still have an airway. So you want to make sure or encourage them to cough out the object. If they're able to do so, great. If not, if then they start wheezing or you can't hear any sounds from them, that means that you should probably start giving them 5 back blows and what? Abdominal thrusts, yeah. So for those abdominal thrusts, making a fist, thumb just above the navel, other hand right around, and you want to kind of make a J, so it starts kind of a curve upwards, okay? And then the 5 abdominal, or the back blows. I'm gonna have Scott be my, he's been my victim today.
It's been a rough day.
All right, so Scott here, he's choking, and he can't breathe and he can't cough. So how you position ourselves, we're starting with the back blows. So starting with your hand over their shoulder, so I'm just gonna bend him forward with the palm or the heel of my hand at 5, 4, 3, 2, 1, right in the center of his back. From there, I'm gonna position myself in between. And don't worry, a person my size and a person his size, this still works. All right, so from here, I will find his belly button, and then from there, making a fist, placing my hand over, and then I'm not gonna actually do it on Scott, but those 5, 4, 3, 2, 1. So you wanna continue this until they either dislodge the object, or if they pass out, and you'll have to safely get them to the floor. Hopefully, especially if you're in this position, you'll be able to get them into a nice recovery position. And then, or if emergency personnel or someone else comes to help you. Okay? Yes?
The emergency sign for choking, Scott, he went right like this, is that like a?
They didn't mention anything about that, but that's kind of everyone tends to just do this when they can't breathe, so it's that's usually the position that you'll find somebody in that case. All right. Any other questions? Actually, I haven't prepared this, but I kind of want to go over a recovery position. Scott, can you come back for a second? So if someone is like on the floor, go ahead and sit on the floor. So if you're just kind of waiting, you don't need to do CPR or anything like that. We're going to try and put him into recovery position so he's protected. So what you're going to do is you're going to bend one of their knees, place their front arm over their head, and they're going to kind of roll them over into a position just like this. All right, so that makes it, especially if they either vomit or have any other bodily fluids, they don't choke on that from there. It's kind of a little bonus thing I decided to throw in. All right, thank you, Scott.
Wait, so you're doing that for what?
So if
Waiting
waiting for someone to come, if you
911.
if you don't feel like you are able to give the proper care to someone, or if they don't need CPR, they're breathing, or they just kind of passed out, and you're not really sure what you should be doing, kind of put them in that kind of position, just like I said, in case someone had like vomits or something like that, you're able to put them in that position so they don't choke on that vomit. So just a little, especially if someone's choking. Oh. All right. I think that's all that I have. Anybody have any questions about anything that we talked about? So those are just a few of the life-saving techniques that are covered in like a CPR class. There are many different ones you can take. You can just do a CPR, you can just do first aid, or you can just do an AED training. It kind of depends on what you're interested in getting certified in. They have all those different options. But yeah, if you ever want to take a class, let me know. I can probably set something up. We can do one here, or I can send you in the right direction. Okay?
Great,
That's it.
thanks.